As we start to see new cases of COVID-19 and more hospitalizations, the U.S. and many states are facing sort of a difficult choice here in the coming months. Will they have to enforce a second coronavirus lockdown to deal with an uptick in these cases? So we're going to take a look at this. We want to bring in emergency care physician, Dr. Elfenbein. You are here to talk us a little bit more through this. I stumbled through your name, doctor, because I don't know what it is. Even though we talk to you every single week, my brain always goes back and forth between Elfenbein and Elfenbein. But we're really, really glad that you're here. So first off, how do we prevent another round of lockdowns? I mean, the expectation was as soon as we started to lift these restrictions, we were going to see spikes. We expected that. But, there's a fear that we will just go all the way back to what we were like, just a couple of months ago.
Yes, I think that's a reasonable, concern that people have. I wouldn't say people should be fearful of it, but I think it's certainly a reasonable concern. Obviously, nobody wants that. So I think one of the big things is people have to just kind of take this all into account, kind of all the recommendations that have been put out and are being put out by the experts, being things like, wear a mask when you're gathered with people. There's been a lot of data back and forth about masks. Some data says they help, some data says they don't, but the overwhelming preponderance of data suggests that masks really do help. So people should really be wearing their masks when they go out in public. You don't have to wear it in your house, but when you're out and about with other people, you really should be wearing a mask. Staying 6 feet apart. I mean, there's good reason for that. So people really should be doing those things that we've kind of ingrained in our heads for the last 3 months that maybe people are getting a little more lax about. But if you don't want to go back to kind of the lockdowns that we had, you really got to be taking this stuff seriously and following the quote unquote rules. They're not that onerous and they're not that difficult to follow. But I think people really need to take it to heart that they really need to do that stuff.
So, doctor, as you know, a number of recent observational studies support wearing masks to control the coronavirus spread. But researchers stress conducting a randomized, double-blinded, controlled trial is nearly impossible during a pandemic. We've talked about this before, the nature of, or the use of masks to prevent the transmission of the virus and the role that they play in preventing the spread of coronavirus. But the concern, of course, is that people were very cautious during the lockdown, and now people are less cautious and people are not wearing masks. Or if they're wearing masks, it's sort of perfunctory. They wear them, but they take them off. They put them below their chins. I see a lot of people walking around the city with the mask underneath their chins, or exactly, their noses are exposed. And it's interesting, doctor, you said we shouldn't be that, well, I've actually become more concerned because during the lockdown, I felt everybody was sort of in it together. And now I feel as if there are some people that are taking it seriously and others who are not. And that makes me worried for my safety.
Yeah, I mean, you're absolutely right. And I think you look at pictures on the newspaper, on the news, people at the beach, people hanging out, people gathering at restaurants and bars, and that see these quote unquote rules have seemed to have gone out the window. People are packed together like sardines and at bars and restaurants and beaches and Central Park. You see pictures in New York of Central Park. It is very concerning. Really wearing a mask, it's uncomfortable, but it's really not that onerous. It's not that difficult to do. And as you suggested, the gold standard in science is really a double-blind prospective study. And that's impossible to do right now. So the best we have are what are called observational studies, which really are just basically you gather up all the data that exists and you look at all the studies that have been done and you kind of make a determination about how good those studies are, and then you kind of weigh the evidence. And those observational studies have shown that masks really, really do help reduce the risk of spreading and contracting coronavirus. Now, the confidence in that data is pretty low, meaning that, yes, we have this data that suggests that it works, but whether we're 100% sure of this or not, we can't really say because it's not a double-blind prospective study. And that's kind of getting into the weeds about how we do science and how we do research. But people need to understand that the data is there, that these things do really, really help. And it's really not that difficult to just wear it over your face and over your nose. Wearing it down here doesn't help, and wearing it down here doesn't help. The mask's got to be over your nose and over your mouth.
Yeah, thanks for that reminder because I've talked about this before that I just feel like over the past few weeks people have become really, really sloppy with this sort of stuff. And what always concerns me is that I feel like every week we're learning something new about the virus that we didn't know before. And so I think we should always be sort of proactive. One of the things that we are starting to see, and this is based on a Dutch study being released, that COVID-19 patients that really only had mild symptoms are having long-term side effects of being exposed to this virus, sometimes going on for months. What can you tell us about this?
Well, as you suggested, that came from a study from the Netherlands, from a Dutch study that looked at people who had what we would consider mild cases only, meaning they did not need hospitalization, and that they really, had mild symptoms, cough, cold, flu-like illness, got better. And for months and months and months, these people reported that they still had symptoms: shortness of breath, cough, headache, intermittent fevers, brain fog, trouble concentrating, chest pain, palpitations, things like that continued for months and months and months. And the scary part about this is that when they looked at these people, 85% of them considered themselves healthy before this happened. And afterwards, only 6% reported that they were healthy. So these are like everyday people that had no medical problems. They were people that, or at least considered themselves very, very healthy. They exercised, they ate well, they didn't take medications for the most part. They were healthy people, and that they continued to have these symptoms for months and months and months. It is very concerning. And as you pointed out, we really don't understand the science behind this, and we don't really understand the pathophysiology, why this is continuing to go on. Could it be that it's your immune response that's causing that? Or could it be that you have some latent reactivation of the virus still inside your body, meaning that it's still in there and it's reactivating from time to time to cause these symptoms? We just don't understand that. So we don't know how to treat these symptoms. That's the big problem.
Wow.
Yeah, that is very eye-opening. And as always, Dr. Ron Elfenbein, we appreciate your analysis. And as Anne-Marie pointed out, it's really important that people take this seriously and that they don't let their guard down, because I know that there are a lot of young people especially who've looked at the last couple of months and have said to themselves, look, I made it, didn't get sick, or I took the antibody test, never had it, and so I'm going to carry on living my life. And the virus is not done with us. Every medical professional that we've spoken to says the virus is still here and we are all still in danger. And we are now at 115,000 people that have died, and the numbers are expected to get to go higher. So we appreciate your time in explaining and breaking this down for us, Dr. Elfenbein, as always.
Thank you, guys. Have a good day. Stay safe.